Dr. Shipley, you are using acceleration in your practice. What does that mean for you and how do you implement it?
So acceleration can mean a lot of things in orthodontics. I firmly believe that in today's marketplace and with the changing dynamics of orthodontics, we really need to be looking at acceleration in total to figure out every way that we can in order to finish a case faster for a patient. And so acceleration means to me much more than just moving teeth faster. To me, acceleration means how do we finish a case faster and get patients out of treatment faster, and there's a difference. We can biologically move teeth faster by changing the way the cells respond in the body so that the teeth actually move faster through the bone, or acceleration can mean we're simply just being more efficient in our practice in such a way that we get rid of all the things that may cause a patient not to finish on time. And there's several different ways of doing that. For just efficiencies, simple things like self-ligating brackets and digital technology to maybe help us position brackets or plan out how we're going to move the teeth before we actually move it. But what's most exciting to me in today's new and emerging world is different ways in which we can stimulate the body so that the bone remodels faster around the teeth and therefore the teeth move faster.
Do you find that in addition to procedures that some appliances can be helpful?
Absolutely. For instance, self-ligating brackets such as the Carriere SLX appliance is a great appliance to help us finish cases faster by implementing self-ligation in a passive manner with light wires to better, more efficiently move the teeth. Another appliance that I find very helpful in finishing cases faster and has been a true game changer in my practice are the Carriere Motion series of appliances, specifically the Carriere Motion Class 2 and Carriere Motion Class 3 appliances. I would used to spend months and months and months having to monitor patients wearing their rubber bands while they're in their full braces. At the same time, they've got horrible hygiene, they're not wearing their elastics, and it's taken forever. The Carriere Motion Class 2 appliance has allowed me to finish these Class 2 cases much more efficiently and much faster. Because we're doing it without the fixed appliances on, the appliance is designed to deliver forces in the most efficient way possible for the teeth so that we finish that rubber band wearing portion of the treatment for the patient even before we put the appliances on. I'll usually leave the Carriere Motion Class 2 appliance on for only 3 or 4 months, and by that time my elastic wear is finished, and then we put the fixed appliances on and we're able to finish the case faster because we're starting from a Class 1 platform. I've also found recently that by adding Propel MOPs in with my Carriere Motion appliance, we're able to cut that elastic portion down even further. We'll use the Carriere Motion appliance and then place MOPs in the posterior region to help with either the distalization, or the rotation of the molars, or to help us move the mandible forward. So I think we've got these great advances in technology that we can apply, implementing efficient strategies, efficient appliances, and doing things to get the bone to remodel better and faster around the teeth. We've got to have this synergistic approach of bringing all these different things from different areas. When we take these ideas and many others, combine them, that's going to help us to be not only competitive and more profitable in the marketplace, but also give the patients what they desire, and let's be honest, what the patients deserve, to finish up better, less painfully, less expensively if possible, and faster.